Bonjour tout le monde. Good morning, everybody. My name is Steve Chapman, and I'm a member of the board of the Ottawa branch of the National Association of Federal Retirees. I would like to begin by acknowledging that the land on which the branch office is located is traditional unceded territory of the Algonquin Anishinaabe people. On behalf of the branch, I'm pleased to welcome you to today's webinar titled Diabetes and Your Feet, presented by Sarab Dormani. She'll discuss the foot complications that can arise from diabetes, preventative foot care, taking care of your feet at home, and when it's the right time to see a specialist. Sarab is a registered nurse and the co-founder and clinical director of the Natural Soul Wellness Center on Carling Avenue. Sarab worked as a critical care nurse in emergency for over 6 years and went on to complete her postgraduate studies with honors in advanced nursing foot care. She loves teaching and does this through the Ontario Podorthic Nursing Association, where she also serves as vice president. Sarab focuses on patient empowerment and advocacy, healthy aging strategies, preventive care, and patient well-being using a holistic approach. This is our fourth webinar with Sarab, and we couldn't be happier to have her back this morning. A few more things before we start today. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. I also want to give a special welcome to anybody here who's not a member of the association, and hope that these webinars will inspire you to join us. And to our members, we hope that these webinars will encourage you to maintain your membership. You can also learn about giving the gift of membership by following the link in the chat box. After today's webinar, the Ottawa branch will send you an email with instructions how to access the recording of today's webinar. There will be a question and answer period at the end of the webinar. Please type your questions in the chat box throughout the session, and Sarah will answer them during the Q&A period. I encourage you to keep your questions fairly general, because discussion of specific cases or patient issues might be difficult since she doesn't know your situation. Now I'm going to turn the presentation over to Sarah. Thank you.
Thank you, Steve. Good morning, everyone. I'll just pull out my screen here for the presentation. And sorry. Okay. Great. All right. So good morning, everyone. Bonjour tout le monde. Thank you for joining me this morning and taking the time to join me to talk about and raise awareness about diabetes and foot health. So this morning we are going to do an overview about diabetes, and then we'll specifically talk a bit more about diabetes, diabetic foot, and foot-related issues. So we're going to start just quickly. Quick disclaimer, this presentation is obviously intended for educational purposes only, and as an overview of diabetes and foot-related topics. It is not intended to replace any medical advice, and the information that I'm sharing with you today are of my knowledge, experience, education, research, and skills. And the content of this presentation was created in guidance with resources from Diabetes Canada and Wounds Canada. And please note that I am not remunerated by these organizations. And if you need advice about any specific medical concern, please speak to your primary healthcare provider. I'll also be sharing some before and after pictures that I've included in this presentation, and they are shared with our patients' permission for educational purposes, and their identities are kept confidential, and results vary from person to person. So just quickly, most of you may already know me, but to the people who are new and that are joining us this morning, my name is Sarab Dormani, and I've been a registered nurse since 2012. As mentioned, my background is actually into critical care. I was an emergency nurse for 6 years, but in 2018, I advanced my practice in lower limb and foot care, specialization for nurses. And I've started my own independent practice and co-founded Natural Soul Wellness Center in 2020. Our clinic is a multidisciplinary wellness center, and we really enjoy providing more of a holistic approach to health and wellness, mainly because in my experience in the ER, I would obviously see people at their worst. No one goes to the emergency because they're having a good day. So going into my own private practice, I wanted to bring in more of an approach of not having to wait to seek medical help when things are going wrong, but rather start taking step into preventing any disease or disabilities or pain or any complications. So we focus a lot on patient education and preventative care because we just absolutely love empowering our patients so they can better care for themselves at home. So just quickly what I do as a nurse specialized in foot care. Well, I offer nursing consultations and assessments and tailor care plans specific to our patients. I provide advanced medical foot care. And although we're going to be talking about diabetes specifically today, medical foot care is really for anyone. Anyone can definitely benefit from having their feet checked and cared for professionally. Our most popular treatments are the medical pedicures, where we provide the foot care, the toenail trimmings, and the skin care. We also do provide diabetic foot screening and care, and we can help with thick, damaged, painful toenails, corns, calluses, cracked heels, skin care, non-surgical ingrown toenail care, fungal toenail care treatments. We do have products that can help with bunions, hammer toes, arthritis, and the aging foot. I'm also certified in compression therapy garments, so related to vascular conditions or lymphedema. We also provide footwear assessments and products and offloading, and we'll talk a bit more how much footwear is very, very important for diabetic feet. We also have one of my other colleagues who is also a nurse specialized in foot care, and she's a bit more specialized in wound assessments and care. And we all work as a team together. All of the practitioners, because we also have practitioners that offer gait scan, custom orthotics, and pain management options. So we're going to start talking about diabetes, because obviously we have to talk about diabetes if we're going to talk about diabetic foot health. So just please know that diabetes is very complex. So my goal today is not to teach you everything about diabetes, because content about diabetes, I mean, we learn this in nursing school over the course of, weeks and months and years. But I'm just hoping that I can raise a bit of awareness on this concern. So in diabetes, I mean, we all know at least someone who is diabetic. And what happens with diabetes is that our body is either not producing insulin or is not responding to the insulin that it's already producing. So insulin is a hormone that is produced by the pancreas, and this hormone allows to regulate glucose, which is sugar, levels in the blood. So what happens is that your body will break down the food that you have ingested into the sugar in the bloodstream. And when your sugar levels go up, your pancreas is going to secrete insulin. And that insulin is going to allow to regulate the blood sugar levels and redirect it either to the different cells for energy or to store it for fat. So you don't want to leave sugar in the blood too long, because you have to think of it kind of like honey or molasses into your bloodstream. And these high levels of blood sugar can damage your body's organs, blood vessels, and nerves. But at the same time, it is very important to have carbohydrates and sugar and glucose in our diet, because it's really our source of energy. It's essential to our life. So we'll talk a bit about the two main kinds of diabetes that we see. So there is type 1 diabetes, which occurs in about 5 to 10% of diabetics and is not a diabetes that is preventable. It is an autoimmune condition. So what happens is that the body is attacking itself. The body is destroying the cells in the pancreas that are creating this insulin. We typically see this more in children and teens, but we have been seeing it also in young adults. And this is a insulin-dependent diabetes. So these people need insulin to be able to live. There isn't any cure for this diabetes, and causes are either genetics, virus, but again, diabetes is also dynamic. We're learning about it every day as research goes on. With type 2 diabetes, this occurs in about 90% of diabetics, and it can be preventable. So what happens is that your body is creating insulin, but it's either not properly using it or just not creating enough. We are seeing it more in adults. However, we are seeing it more and more in children as well, especially with the high rise of obesity in children. This type of diabetes can be managed with lifestyle management and also can be prevented. For treatment, we can either have oral medications or insulin therapy, all depending. That would be further discussed with your doctor. There are also other diabetes, such as gestational diabetes. So you get that when you are pregnant, or there's also prediabetes. So just quickly wanted to share with you some statistics, and this is directly taken from Diabetes Canada. So what we can see is we have the numbers from 2022, and we also have projection numbers from 2032. What we are seeing is that diabetes is on the rise. It is a growing pandemic, and more people are being affected with diabetes. So the other thing that we can also see from these numbers is that we are estimating between 10 to 14% of Canadians are affected by diabetes, which is a very, very big portion. And do also remember that 90 to 95% of these diabetes-related numbers are our type 2 diabetes, which could be prevented. So the type 2 diabetes are still representing these 7-figure numbers. The other thing that we are noticing is that over 5.5 million people have a diabetes type 1, type 2 diagnosed, and type 2 undiagnosed. And that in the type 1 and type 2 diagnosed, there are over 4 million people. So there is still over 1.5 million people, Canadians, that are living every day with possibly type 2 diabetes that is left undiagnosed, unfortunately, and that can start having major effects on their health without them necessarily knowing what's going on. So just quickly, some signs and symptoms of diabetes. Diabetes, like we mentioned, this sugar is left in your blood and it's not good, so it starts affecting all of the organs around. So people are noticing that they're starting to have blurred vision because you have all of these little tiny blood vessels around your eyes, and that can start affecting them. Frequent infections, cuts and wounds that are slow to heal, tingling and numbness in the hands and the feet, increased thirst or hunger, frequent urination, weight gain and weight loss that is often sudden and unexplained, extreme fatigue, dizziness. So we're going to quickly talk a bit about diabetes, diabetic management, because it's important to take the right steps to be able to prevent any complications related to diabetes. So in order to be able to manage diabetes, well, the first thing is to be diagnosed with diabetes, and that is done through blood work with your family doctor. So there are different blood tests that your family doctor can do to see the blood sugar levels in your blood at that moment, but also over the course of the last 3 months and how your blood sugar levels have been. And then once you have this diagnosis, then the next thing is education, because all diabetics do need to be absolutely educated about their condition and how they can start managing it. And to let their surroundings know also about their condition, because if you live in a household, you want to have, that support from your family, your friends, your peers, different community groups to be able to manage your condition. In terms of treatments, well, they do vary. There are, like we mentioned, oral medications, and even in the oral medications, there's a different class of medications. I'm not a pharmacist, so that's always something to talk a bit more detail with your family doctor or your pharmacist, or if you have an endocrinologist, which is someone that a specialist that can look into your diabetes. But different medications can either lower your blood sugar or help your pancreas produce more insulin or prevent the breakdown of certain carbohydrates in your bloodstream. And obviously there are also insulin therapies. Nutrition is another big one because we're talking about blood sugar. So it's what you're eating. So it's not just what you're eating, but it's also when you're eating and how much you're eating. So what we eat does play a huge role, a direct role in our blood sugar level management. And that's why it's also important to involve not just the patient itself, but also their surroundings, because if I talk to the patient about, let's say, nutrition, but they're not the one cooking the food, then I need to bring in the partner, the spouse, who else is in that household that is making the meals and that is doing the meal planning. And sometimes I can make recommendations, but if in their culture they don't eat certain of the recommendations that we're making, then we have to look at all of these different things in terms of finding and helping them create better meal plans to manage their diabetes. Exercise and activities is another big one because physical activities, yes, they help with weight loss, but when you are physically active, your body responds better to insulin. And it also helps regulate your blood sugar levels because you are using that energy and that sugar to kind of burn off those calories. As mentioned, blood sugar management is key, and we do want to avoid complications such as heart problems, kidney disease, leg amputations, infections, vision loss, reduced lifespan, and also, unfortunately, death. So now that we understand a bit more about diabetes, let's talk about diabetes and your feet. So with everything that a diabetic person does need to manage, what we've noticed is that foot care is often forgotten. And it can be challenging for people that have poor vision, that aren't able to reach their feet, that have decreased mobility, and that have decreased sensation in their feet. So unfortunately, these conditions can put our patients at risk of developing a foot ulcer. And when a foot ulcer is left untreated, it can rapidly progress into a wound that can become infected. And unfortunately, that also doesn't take time, where the person can undergo either a partial foot amputation or a full foot amputation. So preventative care is definitely essential for diabetic people that are looking after their feet. So as mentioned, caring for your feet is essential because foot problems can affect us negatively in every way. If you're not able to walk and stand on your feet, your whole day can just definitely crumble apart. You won't be able to go around. There's risks of using more medication to manage your pain. We're noticing that there is an increased risk of fall. If you're not able to go to work, there's a risk of losing wage. So there are a lot of impacts, negative impacts from foot-related complications. In terms of foot health, in Ontario specifically, and these are statistics, again, from Diabetes Canada from 2022 numbers, we were estimating that over 1.5 million to over 2 million Ontarians are living with diabetes. And statistics show that 15 to 20% of these diabetics will develop a foot ulcer. So that can be anywhere between 25,000 to 47,000 Ontarians that have had or still have a foot ulcer. And ulcer complications can lead to lower limb amputations, which are also known as the non-traumatic amputation. And the sad part about this is that 85% of these amputations could have been prevented. So when we are talking about foot ulcers, and I've only put the image of a cartoon, I was obviously not going to share any images this morning, but please note that this is a reality, and it's something that we unfortunately do see in our clinic. It does happen. So what we know with diabetes is that the complication related to the feet is that there could be poor circulation and nerve damage. Your feet are already subject naturally to poor circulation because they're far away from the heart. So add diabetes to that and things are just a bit more complicated. With the nerve damage, also known as neuropathy, what happens is that you're less likely to feel an injury, such as a blister, a cut, a skin crack, or if you step into an object. So there is nerve damage to the foot, and the person can be walking on something and absolutely not feel it at all. And I know this because in our clinic, we've unfortunately had patients that came in and they had glass stuck in their feet, and they had the glass for days up to weeks on different cases, and they had no idea that they had a foreign object in their foot. I've also removed other foreign objects that were stuck in the patient's foot, and again, they did not feel anything. So that increases the risk of developing a wound. Now you add the blood circulation problems to that, and what happens is that you have a wound, but then you don't have good blood flow that is helping the wound to heal. There's not enough oxygen, there's not enough nutrients, the skin cannot repair itself, so there's a delay in healing. Now, if this wound is left open, it is basically a free way for any bacteria, any infections to go in there and start infecting the foot. The other issue with this is that there is not a lot of thick layers of muscle and fat pads in the foot before we reach to the bones. The bones are very, very close to the skin. So when an infection goes into the foot, it doesn't take much before it hits the bones. And once the bone is infected, then we're really, really rushing through, we're racing against the clock because bone infections can be very difficult to treat. And often that's what can lead to the foot amputation. So with this being said, we need to assess the barriers that are delaying the wound to heal. And we need to ring the alarm and get a multidisciplinary team involved. So we've had patients coming in with ulcers and infected ulcers, send them to emergency, get antibiotics as soon as possible, get them more specifically with a nurse that will follow them with the wound care, because that is absolutely needed. They have the foot care portion, and then they have their pharmacist, because we want them to be able to manage their blood sugars, because if you don't manage that blood sugar, that wound is not going to heal. Nutrition is also very, very important. Yes, you want to manage your blood sugar, but you also need a diet that's a bit more richer in protein to be able to help, the skin to heal. So it's really important to look at all of the different factors, and it varies case by case. So everyone is going to have a different care plan, but ultimately the goal is to save the limb. So here are a couple of different factors that we need to address when we're looking at a foot ulcer. So what are the different risks of developing a foot ulcer? So we talked about peripheral neuropathy, and we'll talk about it in the next slide a bit more in detail. If there is a risk of previous ulcers and amputations, if there are any bone deformities, so if there is a bunion, a hammer toe, so any bone that's kind of like sticking out on the foot can create sort of more of a surface contact against a shoe or something like that, and then that can create an ulcer. Poor blood flow in the legs, any limited range of motion in the foot, and we'll talk about it at the next slide. Ingrown toenails, fungal toenails can create pressure and ultimately create a wound. Calluses, corns, poorly managed blood sugar, poorly fitted footwear, walking barefoot, because if you're walking and you step on an object, that can definitely increase your risk of developing a foot ulcer. Any injury, trauma to the foot, and poor foot hygiene. Ultimately, the important thing to remember is that all diabetics are at risk of developing a foot ulcer. So you've probably heard about neuropathy. So like I mentioned, the nerve damage that diabetic people can go through. However, neuropathy is not just for diabetics. There are other conditions that can lead to neuropathy. There are other health conditions as well. But specifically to diabetics, what happens is that the high blood sugar levels is a risk factor, and that can start creating some nerve damage to either the feet, the legs, but we are also seeing it in the hands and the arms as well. So symptoms often start with burning, tingling, pins and needles, numbness to the feet. And then there are different stages to neuropathy, but then the end stage is really that loss of sensation. So, and that's where we are seeing an increased risk of diabetic foot amputations, because they just really absolutely do not feel anything. And then they can hurt themselves and not know about it. And if they're not able to reach, to look under their foot, if they're not able to see very well, then whatever damage that's happening to their foot is left untreated, unfelt. In terms of neuropathy, there's so much we can say about it, but ultimately we don't really have a cure, but we can manage it. We can manage the symptoms, and we can also manage the diabetes to reduce the risk of the neuropathy to progress and get worse. So there are different kinds of types of neuropathy, and we can also screen neuropathy in our foot clinics as well. So the first kind of neuropathy is what we call sensory neuropathy. So that is the sensation that you were having on your foot. So if you are feeling pressure from like a poorly fitted shoe that's feeling tight, if you're stepping onto something, if you dip your foot in the bathtub and the water's too hot, that is your sensory neuropathy. So that is your sensation. And that is what we're able to detect with a monofilament shown in the picture on the top there to your right. That we can detect it in the clinic to see if there is complete nerve damage in certain areas of your foot. Then we also have motor neuropathy, and that affects your muscle strength and your reflexes in your foot. So what happens is that there is also an increased risk of ulceration with that kind of neuropathy, because you're losing, fat pads, and you're losing muscle mass into your foot. Well, then you have more bone to skin contact with a hard surface. So there is a risk of ulceration with that. Because you don't have any natural cushion protecting your foot. But the other thing also is that if you do have joint stiffness and limited range of motion into your foot, that can also increase your risk of ulceration. So one of the things that we also look into the clinic is see how you're able to move your toes, especially the big toe, because when we walk, what happens is that our big toe propulses up. So our big toe stretches its way up as it's having contact with the floor to be able to kind of push the foot before the other foot goes when you're walking. And when there is a limited range of motion in the big toe, that toe stiffness forces the toe and the foot to be more shuffled and dragged onto the ground rather than like lifted up when you are walking. So when you're walking, you're constantly dragging your foot onto the ground, then you are creating more of that shear pressure, and you are creating more the risk of causing a callus and eventually an ulcer. And then the other kind of neuropathy that we have is the autonomic neuropathy. So autonomic basically means that your body is doing something without us thinking that it's doing it, or without us saying, okay, you have to do it. So an example of that would be your heart beating. In terms of neuropathy related to the foot, what happens is the sweat glands are also a body's autonomic response. We don't say that we have to sweat or not. We kind of sometimes wish we didn't, but our body still does it anyways. And what happens with the bottom of your foot is that you don't have any glands that produce natural oils to keep the skin hydrated. So the bottom of your foot depends a lot on the sweat glands to keep it hydrated. Not always great, but I mean, it's still something anyways. But what happens is that when these nerves are damaged, then your body is unable to create that sweat moisture at the bottom of the feet. So the skin of the foot is not hydrated well, and the skin starts to become dry and can crack. And then those skin cracks can lead to ulcers and wounds. All right, I hope I haven't lost anyone so far. I know it's a lot of information, but I hope that so far you're still enjoying the presentation. So now we're going to talk a bit more about preventative care. So as mentioned before, and I'll mention it again, how do you manage diabetes? Well, you manage it with monitoring your blood sugar. And I do want to talk a bit about blood sugar management. I mean, I'm not a diabetic specialist, whatnot, but this is something that I see a lot in my career is that often people say, oh, yes, I do manage my blood sugar, because these are questions I ask when I do see a diabetic patient at the clinic is, well, how often do you check your blood sugar? And sometimes I'm told, okay, well, once a day. And I'm like, okay, well, when do you check your blood sugar? Oh, well, in the morning when I wake up. Okay, do you check it any other time of the day? No. And I'm like, but if you only check your blood sugar in the morning, you are always going to have really, really good readings because you haven't ate anything in the last, 7 to 8 hours. This is a fasting blood sugar. So basically, it's more encouraging people without being scared, but more educating them and letting them know that if you're told to take your blood sugar once a day, then try to take it different times of the day. All of our blood sugars are great in the morning, but take it before lunch, take it at 2 in the afternoon, take it before supper time, take it before bedtime. It's important to kind of see that variety in your blood sugar. You are having a couple of meals and a couple of snacks a day. So try to bring in more variety when you are monitoring your blood sugar, and have a little journal and write the numbers down. And then you bring those numbers to your next appointment with your primary healthcare provider or your specialist, your diabetes specialist. The other thing too is sometimes I ask my patients and I'm like, okay, well, how often do you monitor your blood sugar? And if they say, oh, well, I check it with my doctor once every 3 months. That blood work, which is called the A1C, gives us sort of an average reading of what your blood sugar levels could have been in the last 3 months. It's a very, very important and good test, but it shouldn't be the only way for you to manage your blood sugar levels, because you're having, again, a couple of meals and a couple of snacks a day. And then that can fluctuate your blood sugar. So you can maybe be eating something and your blood sugar could have spiked and you didn't even know about it, because you're only slowly, depending on a test, that's managing your blood sugar once every 3 months. And that's a lot of, blood sugar variations. That's a lot of meals. So these are important discussions to have a bit more with your healthcare professional that is managing your diabetes. Blood pressure checks is another really important one, because unfortunately diabetes doesn't come alone. It can come with heart complications. And if our blood pressure is too high, it can start tearing and breaking the inside of the artery vessels. So that can increase the chance of having damaged vessels and increasing the risk of having poor blood flow in our body and in our legs. So we talked about nutrition, talked about physical activities in terms of managing, but specifically to the feet, the first big thing that you can do when you are a diabetic and even a non-diabetic is to check your feet. Daily foot inspections, and yes, every day, take 2 minutes to check your feet. If you're not able to reach or see, ask for help. Use a handheld mirror, but definitely you're looking for anything that could be abnormal onto your feet, any cuts, blisters, swelling, redness, and then you want to address that to a healthcare professional immediately. You also want to make sure that you're having proper foot hygiene, that you're keeping your feet washed every day and then clean and dry, very well dried in between the toes to reduce the risk of developing any foot fungus in between the toes. You want to hydrate your feet. You want to moisturize them with a urea-based lotion. So you want to keep in that moisture into the skin of the feet. Wearing fresh, clean socks is important. Properly fitted footwear. We want to wear shoes that are safe and comfortable. We'll talk about shoes soon. You want to verify the inside of your shoes. I've had this one gentleman that I removed dog hair and pebbles out of their ulcer because they were wearing their shoes with no socks and things got in there. So this is definitely not something we want. And if you do have neuropathy, then you could have a rock in your shoe and not feel it. So you want to put your hand in your shoe, see if there is something, shake them out, remove any possible foreign objects. Check your water temperatures when you are going in the bath and the shower, because if it's too hot, it can create some skin burns. Also avoid walking barefoot. That's as much indoors and outdoors. We are spending a lot of time around the house, so you don't want to walk barefoot around the house. And definitely recommend having your feet taken care of by a professional and medical foot care specialist, not necessarily going to a basic nail spa to have your feet taken care of. Nail technicians, they're not medical professionals. They're not trained to look after diabetes, manage diabetes, and be able to provide a care plan for diabetic foot. Also with diabetics, we don't recommend soaking the feet because it can open up the pores and increase the risk of infections. And this is something that at most medical foot clinics, what we do is more of a dry pedicure. We use products that specifically are going to like target certain areas of the feet, but we don't submerge the feet into any water. And it's also important to have a professional that knows what they're doing. I've had diabetics that unfortunately had infected ingrown toenails coming into our clinic because they went just a basic spa and they went to see someone, they cut their nails too short, the instruments weren't well sterilized, and they ended up with an infection. So it's very unfortunate. So as mentioned, we are just quickly going to talk about footwear and diabetes. So shoes can make or break your feet. So wearing the appropriate footwear and also socks is essential, because with neuropathy and poor blood flow, you may not feel pressure or trauma in certain areas of your foot when you are wearing, like, let's say a shoe that is too narrow. It can definitely cause more harm and damage to the foot. There are risks of bruises, corns, calluses, blisters, and ulcers. And if you are wearing a shoe that is more plasticky, that is not a material that's not breathable, it can also trap bacterial and fungal infections. And wearing the appropriate footwear, again, as important indoors than it is outdoors. So if you are around the house most of the time, then you need to have a shoe that is safe for your foot. So when you are looking for a shoe, you want to make sure that it's the appropriate width, depth, and length. So not just the size, but also if it's wide enough, if you have enough wiggle room for your toes. You want to make sure that the shoe has a firm heel, that your foot is not wiggling from side to side into the shoe. So comfortable toe box, make sure that the insoles are removable if ever you need to put in your own insoles. Easily adjustable with lace, Velcro, bungee straps, because I mean, I know slip-on shoes, they sound great, but having a shoe that is adjustable is a lot safer for your feet, and that the inside of the shoe is soft, and that you also wear socks with your shoes to reduce any friction or pressure. And just quickly want to mention about one of the services that we have also started offering at our clinic last year in terms of helping people understand more of those abnormal pressures onto the foot, because what we are noticing is that people do have loss of muscle and fat pads into the foot that can lead to calluses and ulceration. And like we mentioned, that limited range of motion to the feet can also alter our gait and the way that we're walking, the way that we are stepping on the ground, and that can increase certain pressure points. So a gait scan assessment is a great tool to visualize those and help us basically to map those pressure points onto the foot and to look into providing more custom cushioning to the foot when your body is not able to have its own natural cushioning. So basically, when it comes to diabetic foot care, when you are seeing a professional, it's important to make sure that you are you're taking more of that multidisciplinary approach. Get your different healthcare professionals, let them know that you have diabetes and that how they can help you to keep your feet strong and healthy. So typically in clinic, what we do is we provide a general assessment. We take in the patient's health history. We do what we call a diabetic foot screening. So you can kind of see it on the top right corner up. It's the INLO's diabetic foot screening, and it's from Wounds Canada. And it's basically what we're doing is we're assessing the different risk factors that can increase the person's chance to develop an ulcer, because essentially that's what we want to prevent. And then we'll kind of like talk more about the different treatment plans. We provide a skin, toenail, neurological, vascular assessment. We're looking at the muscles and the bones. I love it when my patients come in with their shoes. So we can also look into their shoes and see what they're putting their foot into on a daily basis. Knowledge is power. So there's a lot that you can do at home in terms of preventing any foot-related complications when it comes to diabetes. And we want to make sure that we're taking a team approach. So, and we are involving our patient. You are your biggest advocate. We're kind of giving you the tools, but you are ultimately going to be making a lot of these decisions yourself, and how you are going to manage your diabetes and your foot health. You're the one that's making these appointments. You're the one that is doing these checkups. So it's important to make sure that you have all of the tools to be able to keep your own feet safe. And you know, involve your family doctor. Like, I unfortunately still have patients that tell me my family doctor doesn't check my feet. Well, the next time that you go in to your family doctor appointment, take your shoes off and ask your family doctor to also look at your feet. You know, this, just get the word out there on how different professionals can help you and how people around you can help you, just to keep everything well under control and safe. And as mentioned before, definitely recommending more of a advanced medical foot care and not just a basic appointment at other nail spa salon. Again, never too late to start, but don't wait until you have a foot problem to start, because the sooner is better. So as mentioned, just like your eyes and teeth, your feet also need a routine checkup. The next couple of slides, I'm going to go through them quickly. It's just a couple of before and after pictures, just because I wanted some people to visualize a bit more how it's important to receive more of an advanced foot care. So again, I've kept everything PG, nothing too bad. So just over here, before and after of a patient I did a couple of weeks ago. On the left, you have a very big, thick, damaged nail that was causing a lot of pressure onto the end of the toe. And then after we cleaned it up, you can see that the skin is just a lot less irritated and has a lot less risk of developing any possible ulcers or complications. Over here, however, we did have a patient that had neuropathy with a thick toenail. And then once we kind of started removing that toenail that was just crumbling off, we noticed that there was a wound under. Thankfully, the wound was not infected, but there was a pocket of wound under the nail, and she had no idea what was going on. So what we did is we did some wound care, got her healthcare team involved, and just in terms for that wound to heal. So when that nail grows, it doesn't go over the wound again. Here we have what we talked about, those abnormal pressures. So that hard buildup of skin, which is also known as a corn. Thankfully, after removing this, there was no ulcer under, but in numerous occasions in the past, I've unfortunately removed corns and that there had been already an ulcer under the corn. So what happens is that the skin is coming off and we're starting to see some underlying structures like the muscles and things like that. So then we have to, again, ring the alarm and get the healthcare team involved. This quickly is an infected ulcer that I had in a patient who wasn't able to reach their feet, had severe neuropathy and poor vision. So these ulcers were all infected on the left, and he had no idea he had an infection. They were actually brought in by a family member to have their feet checked. So we send them to the emergency and started a whole treatment plan. And then 10 weeks later, on the right, you can see that the foot is healed and that the ulcers are healed, the wounds are closed, and that obviously the infection's been under control. But this is unfortunately how it starts, and it can quickly deteriorate. And last picture, you guys have been great. But I also wanted you guys to visualize what it is when we have patients coming in with cracked heels, because often people think that cracked heels are cosmetic, but they are not. It's actually the skin that is broken. Luckily, in this patient, the cracked heels did not lead to any fissure or inflammation, but many times I have seen cracked heels affecting the underlying structures of the skin and then leading to a wound. So then we do have to do wound care on the heels to be able to close those skin openings. Thank you very much for giving me the opportunity to talk to you guys. I know it was a lot of information, and again, like I've definitely, when you're talking about diabetes and foot health, this is done over the course of months and years. So I did my best to try to provide you with as much information in the 45 minutes. I hope it wasn't too overwhelming. But again, thank you all today for joining me as we discussed about raising more awareness about diabetic foot health. And I also wanted to thank again the association for giving me another opportunity to be able to talk about my passion in terms of providing preventive care and education. Thank you.
Many thanks, Sarab. We have a number of questions in the chat box, so I'll start reading them out, and then you can reply. Can you suffer from peripheral neuropathy when you are not diabetic? Do the burning sensations happen at any time of the day?
Yes. So as I mentioned, although we talked about peripheral neuropathy specifically to diabetes, I have seen, and there are cases of patients having neuropathy that is not related to diabetes. So that can either be, cancer-related conditions, chemotherapy, I've had patients with rheumatoid arthritis that had neuropathy. I've had patients with MS, Parkinson's, other neurological conditions. Oh, I've also had patients with surgery, with like knee replacement surgeries or foot surgeries, because when you do have a surgery, you are making an incision in the nerves, and then that can also damage the nerves. So different conditions, and yes, you can have it any time of the day.
All right. The next question, do you have any examples of commercial urea-based lotions?
So you can pick up a urea-based lotion at the pharmacy or see a foot clinic that has products. I, unfortunately, with my college, I'm not allowed to call out a brand. Those are strict regulations, because then they think that I'm working for the company and promoting them. But I can tell you to either visit your pharmacist or visit the website of different foot clinics and see the products that they do carry. I can tell you that most urea-based products that I'm familiar with, that I've also used, are safe for diabetics.
What do you think about zero-drop running shoes? Is it better to avoid them if you are diabetic?
Let me just see exactly the zero-drop running shoes, sorry. So in terms of footwear, the other thing that I wanted to also mention, and I'm not so sure about these shoes, but if you have a shoe that you can bend, it already indicates that the shoe doesn't have a a firm sole, and that is not providing enough protection to the bottom of the foot. So you want at least a sole in your foot that is thick enough to be able to provide better protection for your foot. So I feel like the shoe material, if it doesn't seem to have visually a very, very thick sole at the bottom of the foot. So I'm not so sure about these ones.
Okay. Does OHIP cover services at your clinic?
No, so unfortunately, if I had more time, I would have talked about that, but because I had a whole advocacy slide about that, but I removed it. But no, unfortunately, our services are not covered by OHIP. there are certain insurance companies that do cover nursing care and foot care services. So if you do have private insurance company, you can definitely look into that. But with the rising number of diabetes and foot-related complications, because the more diabetic numbers, the more Canadians are affected by diabetes, the more Canadians will be affected by diabetic ulcers. So I do wish that our healthcare system had better coverage for that.
Good. I have a question that's a little specific. The person is asking, he's been diabetic for over 40 years, not on any meds, but still has peripheral neuropathy. Are there any meds to help the condition?
So again, yes, it is a bit specific because I don't understand if the meds that he's not on are, is it like the diabetic meds or, so I do need to understand a bit more how the diabetes is managed and where the neuropathy is affected. And if this is a conversation that was brought up with their family physician at first. And then talking about, obviously, what we offer at our clinic are non-pharmaceutical options to symptoms and management. So we do offer treatments like cold laser therapy, acupuncture, but these are more for people that are looking the non-pharmaceutical route. And again, it's more for managing symptoms because we're not able to necessarily cure and reverse nerve damage.
Do you have any advice on types of sports shoes when you have orthotics?
Sports shoes, making sure that you do have something, again, any shoe, it always comes back. And if to the basics of making sure that the shoe is well fitted, that there is a firm base and that you are able to remove the insole and put in your own insole. So if you have a shoe that already comes with an insole, it's definitely not ideal because then you're adding cushion over cushion. But ultimately, what I recommend is having a proper foot assessment at a place that does offer shoes. Take the time to talk to someone and then bring your insoles to these appointments, to these outings, and try them in the shoe because you want to make sure that you have enough wiggle room. And it also depends on the sport that you're doing. Unfortunately, I would say my biggest challenge is when I'm seeing diabetics, if they are playing soccer or, shoes that do have to be very well fitted, then we're kind of like not a bit stuck, but a bit more particular because we just still want to make sure that nothing is causing any damages to their feet.
Great. What type of indoor shoes would you recommend?
Indoor shoes can either be, it could be like a closed shoe or a very, very good, comfortable orthopedic sandal. I've seen both. And we do have different models, other clinic as well. But ultimately for indoor shoe, something that's really, really well breathable. I have a shoe that, it's all these like little mesh holes through. And I just feel, although I do wear socks with it, but just something that just feels a lot more flexible and a lot more comfortable. And again, make sure you have enough wiggle room for your toes, that the material is soft. And that it's comfortable.
All right, that's the end of the questions.
Yes, I'm sorry, I'm limited in how I can talk about brands specifically because of our colleges, but all I can say is visit websites and you're free to do your own research. We do have different products also available on our website. Right. And my email is on there. So if ever you have any other questions, please send me an email. I'm more than happy to answer them.
I have one additional question that just came up. It's quite long and fairly specific. Okay. What I'm going to suggest is that Sarab reply directly to the individual because it's a fairly specific question.
Okay.
Okay.
No worries. Here, I'll escape.
All right. So thank you for your participation in today's webinar. The Ottawa branch would like to thank our speaker, Sarab Dormani, for her wonderful presentation. I want to remind you to watch for our follow-up email, which will include information on how to access the recording of today's webinar and information on Sarab and how to contact her. And if you have any follow-up questions, or if you want to book a meeting, you can certainly do that once you've received the email. Remember that you can invite non-members to attend our webinars and try us out as a guest. To register for upcoming webinars, please visit the Ottawa branch website. We will make sure to include our website address in the follow-up email. And once again, I'd remind you to please spread the word about the webinars. If you find them interesting and helpful, please consider joining if you're not a member, and consider renewing if you are a member. There are lots of benefits and perks that are involved with members. Thank you again, and looking forward to seeing you at the next webinar. Merci beaucoup et au revoir.